Have you ever stopped to think about what really happens in your body right after ejaculation? Most men don't. They finish, clean up quickly, maybe lie down or scroll their phone, and move on with their day. But what if I told you that this exact moment, the few minutes right after climax, is one of the most important opportunities to support your health, your stamina, your prostate, and even your mood? For men over 50, this window of time holds powerful potential. And yet, most never even think about it. Your body just performed a full-body event. Ejaculation may feel like a brief moment of release, but inside your body, it's a complex biological event. Within seconds, your brain, nervous system, blood vessels, muscles, and hormones are all involved. Here's what just happened. Testosterone levels temporarily drop. Dopamine, pleasure hormone, spikes, then crashes. Your heart rate increases, and then slows. The pelvic floor contracts intensely. Blood vessels dilate, and then constrict. All of this is normal. It's nature's design. But for men over 50, your body doesn't bounce back as quickly as it used to. That's why this moment, right after ejaculation, matters more than ever. Why post-ejaculatory fatigue happens. Many men report a strange feeling after climax. They feel drained, sore, foggy in the head, slightly irritable, or even emotionally off. And most never connect these symptoms to the act itself. But the truth is, your body just experienced a hormonal drop, especially in dopamine. If your testosterone is already low with age and your stress hormone cortisol is high from daily life, this can hit you harder than you expect. It's not your imagination. It's your biology. The number one mistake men make after climax. Let's get specific now. Most men, after finishing, will either collapse into bed, sit in a slouch position, or stay in tight underwear and synthetic clothing. It feels relaxing in the moment, but this habit can cause blood flow to slow down, pelvic floor tension to stay locked, inflammation to begin in sensitive areas. If you've ever felt heaviness or soreness or had trouble with erections the next day, this might be why. Your recovery window, why it matters. Think of this moment after ejaculation like a cool-down period after exercise. Your muscles need oxygen, your hormones need time to stabilize, and your body needs gentle movement to recover. Just lying down right away can trap tension in the lower body and slow hormone recovery. Your body needs you to move lightly, stretch gently, breathe deeply, allow blood to circulate freely. This helps prevent things like chronic pelvic pain, prostate inflammation, prostatitis, post-ejaculatory soreness, lower libido and stamina. What to do instead, step by step. Here's a simple post-release routine that works for most men. Clean up gently. Use warm water and mild soap. Pat dry with a soft towel. Change into clean, breathable cotton underwear. Stand upright and breathe. Inhale through your nose, deep into your belly. Exhale slowly through your mouth. Do this for 5 full breaths. Light movement. Walk slowly around your room or hallway. Roll your shoulders and hips gently. Try light stretches, forward fold, side bends, or hip circles. Avoid slumping. Don't go right back to the couch. Avoid scrolling on your phone in a curved position. This light movement helps. Flush out tension in the pelvic floor. Encourage blood flow. Support faster recovery of testosterone levels. Addressing the emotional crash. It's not just physical. Some men over 50 report a deep emotional drop after climax. They feel lonely, sad, empty, or even guilty. This is more common than you think. Why does it happen? It's tied to the dopamine drop we mentioned earlier. When dopamine crashes quickly after orgasm, and if testosterone is already low, this emotional crash feels more intense. It doesn't mean you're weak. It means your nervous system is asking for care. Simple emotional recovery tips. Here's what you can do to soften the emotional dip. Sit quietly for 2 to 5 minutes, eyes closed. Place one hand on your chest or stomach and breathe. Drink a glass of water slowly. If you feel heavy or emotional, write down your thoughts, even one sentence. A little compassion goes a long way. You just went through a powerful, intimate event. Your body deserves acknowledgement and support. Coming up in part 2, in the next section, we'll explore the link between post-ejaculation hygiene and prostate health, why urination after sex/masturbation protects your system, what to eat and avoid to support hormone recovery, how to keep your prolactin levels in check, and a 7-minute recovery ritual that helps men feel better mentally, emotionally, and physically. So don't skip part 2. That's where we take everything you've learned and show you how to apply it with real-life tools at work. Let's end part 1 with this. You're not too old, you're not broken, and you're definitely not alone. Your body is just asking for a little more care, and if you listen, it will reward you with more energy, better recovery, and a stronger connection to yourself. In part 1, we explore the hidden impact that ejaculation can have on the male body, especially after the age of 50. We talked about the hormonal shifts, the emotional drop, the muscular strain, and how simple post-release habits can help or hurt your recovery. Now, in part 2, we go even deeper. We're going to look at the overlooked but critical elements of hygiene, nutrition, hormone support, and emotional care. Things that most men never think about, but that make a real difference in how you feel not just in the moment, but for hours and even days after. Let's get started. 1. Why hygiene after ejaculation is non-negotiable after 50. This might sound basic, but it's actually crucial. When you ejaculate, the urethra becomes slightly more open. The surrounding skin may stay warm and moist, especially if you're wearing tight or synthetic underwear. This combination creates an ideal environment for bacterial growth, especially if you don't clean up properly. That's why proper hygiene is not just about feeling clean. It's about preventing irritation, infection, and chronic inflammation that can affect your prostate and urinary health over time. Here's what to do. Use warm water and a mild, fragrance-free soap. Gently wash the entire area, especially if uncircumcised. Clean under the foreskin carefully. Avoid scrubbing harshly. Pat dry with a clean towel. Change into loose, breathable underwear, preferably cotton. Avoid staying in tight, damp clothes for long periods. 2. Always try to urinate within 15 to 20 minutes. This is one of the most important tips for bladder and prostate health. Urinating after ejaculation serves multiple purposes. It helps flush any remaining semen or bacteria from a urethra. It clears out possible contaminants. It reduces the risk of UTIs, urinary tract infections, or inflammation, especially for older men whose urinary systems may already be sensitive or slower. This is a simple yet powerful habit, so don't skip this step. It takes 30 seconds but pays off big in the long run. 3. The hormonal trap. How prolactin affects your drive. You probably heard of testosterone, but what about prolactin? Prolactin is a hormone that rises naturally after orgasm. Its job is to help your body relax, reset, and pause sexual desire temporarily. In small amounts, it's helpful, but in men over 50, prolactin can linger longer than it should, especially when combined with poor sleep, high stress, inflammatory foods, lack of recovery habits. Elevated prolactin suppresses your testosterone and can leave you feeling tired, flat, emotionally low, disinterested in intimacy. This is not a flaw. It's a biological signal that your system needs care. 4. What to avoid right after ejaculation. You may be surprised, but the first 10 to 30 minutes after climax are sensitive, and what you choose to expose your mind and body to during this time affects your hormonal recovery. Here's what to avoid. Bright phone screens, especially social media or news. Caffeine, alcohol, tight sitting positions, cold exposure, or stressors. These things spike cortisol, the stress hormone, which can interfere with testosterone and deepen the dopamine crash. Instead, think restoration, not stimulation. 5. Gentle recovery ritual, 7 minutes. Want a simple routine that you can follow after climax that supports physical, mental, and emotional recovery? Here's one that works beautifully for most men over 50. White heavy checkmark step by step. Post-release recovery ritual. Step 1. Clean gently, 2 minutes. Use warm water and mild soap. No rush. Breathe slowly as you wash, and switch to clean, dry underwear. Step 2. Deep breathing, 2 minutes. Stand or sit comfortably. Place one hand on your belly. Inhale for 4 seconds through your nose. Hold for 2 seconds. Exhale for 6 seconds through your mouth. Repeat 5 times. This helps reset your nervous system, supporting emotional balance and testosterone recovery. Step 3. Light movement, 2 to 3 minutes. Walk slowly around a room or do gentle hip rolls, side stretches, or a simple yoga pose like child's pose or a seated forward fold. Movement flushes out pelvic tension and restores circulation to your lower body. 6. Recovery foods that support male hormones. Eating the right thing after climax? Most men don't think of it, but it helps if you can eat or drink something within 30 to 60 minutes of climax. Here are 3 great options. Roasted beets or beet juice. Supports nitric oxide and blood flow. Watermelon slices. Contains citrulline, which helps blood vessels and recovery. A handful of Brazil nuts. 2 to 3 only. High in selenium. Great for testosterone support and sperm health. Pair any of these with a tall glass of filtered water, and you're giving your body nutrients it actually needs post-release. 7. Don't skip emotional awareness. Here's something many men were never taught. After you climax, you're not just physically open, you're emotionally open too. You're in a state where your nervous system is soft, quiet, and vulnerable. If you rush back into distractions, phone, TV work, you miss an important opportunity. Try this instead. Sit quietly for 1 minute with one hand on your chest. Ask yourself, how do I feel right now? You don't need to solve anything, just listen. You may be surprised by what you learn about yourself. When you meet yourself with care in this moment, something shifts. You build not just health, but self-respect. 8. Final thoughts. It's not about control. It's about connection. Let's end this with the most important truth. This isn't about controlling your body. It's about reconnecting with it. You don't have to be perfect. You don't have to follow a strict rule book. You simply need to listen to what your body is telling you and offer the support it needs to recover, restore, and stay strong as you age. Whether you climax once a week, once a month, or once a day, it's not the frequency that matters most. It's how you treat yourself afterward that shapes your stamina, your health, and your sense of power as a man. You are not past your prime. You are in a new chapter, one that rewards wisdom, care, and respect for your changing system. So next time, don't slump, scroll, or ignore what your body is asking. Pause, breathe, move, nourish, reflect. This is your body. This is your health. This is your time.